Hello, we're here today to present what we learned from an interview with a dentist. But before we start, let us introduce ourselves. My name is Noravit.
My name is Pasim.
My name is Pumalin.
My name is Warakan.
My name is Sanapop.
My name is Ekanet.
There are 11 questions that were given to the dentist. Keep in mind that we are going to talk mainly about opinions on dental profession and experiences. But before we start, I would like you to know a little bit about some background information about this dentist.
For background information, her name is Matcha Nawangka Satusat. She is graduate from Faculty of Dentistry, Chulalongkorn University, and now she has worked at Thammasat Hospital for 6 months as a dentist and also work with doctor when patients has more disease or emergency case. Thammasat Hospital has only 15 dentists, and in the normal situations, they must cope with the 100 patients a day, except Saturday and Sunday. Okay, let's go to the next topic.
What is her reason being dentist? The reason that she became a dentist because many of her friends become doctors, but she didn't want to be a doctor. She also thought about being a veterinarian, but her family didn't agree, so she became a dentist. The next question, what are the benefits and drawbacks of being dentist? About the benefit, she thinks that a dentist have a lot of free time, not working hard compared to other jobs, have a good income, and can manage work-life balance easily. About the drawbacks, the dentists have to work hard in some days, work in the patient mouth all days, having a bad effect to your body, especially the hand. Many of dentists get their hand hurt and they had to go to therapy. And also most of dentists can't work more than 60 years old due to their body. Let's move to the next question, how the COVID-19 affect her practice.
For these questions, she said that dentists don't have the bad effect from COVID-19 situations because they always wear masks, N95s or PPE before treating the patients so as to protect their life from saliva, bud, and communicable disease such as flu or AIDS. In addition, their salary don't reduce, but she doesn't mean that dentists don't adapt to COVID-19 situations. Many hospitals, such as Thammasat Hospital, treat only the emergency case, such as pain from severe tooth decay or wisdom tooth and curing root or cracked tooth, or treatment must be in the negative pressure room in order to prevent the contagion of bacteria. Moreover, they must get the vaccine. Let's go to the next topic.
Now, let's have a look at patients at her workplace. There are all kinds of patients at her workplace, different in genders, ages, and occupations. But there is one outstanding group of people, undergrad students. Undergrad students from universities nearby usually come to the hospital, mostly for orthodontic cases. Moreover, foreign undergrad students would come to her hospital for oral checkups as well. And most of her patients are well cooperated, treated her with respect as one of knowledgeable doctors. And some of them sometimes can be challenging in communication, sometimes. Next, let's move on to the her work skills and interest of the field of study in the future. Her performance in tooth extraction is excellent. She is confident about this. She's been gathering the experiences since she was a grad student. And let's talk about her weakness. Her weakness is endodontics. She told us that it requires a totally different skill from others. You're working with a limited space in a tooth, which you can't see. Now, about her interest in the field of study in the future. She told us that she's been interested in periodontics. Due to the variety of the cases it can apply, she said it will be very useful in her work in the future. Next, we will talk about the experience at work.
Okay, so about her experience working at the hospital, she said that she had found 3 challenges. The first one is she has less time to finish each case. Like, for example, when she was a dental student, she may have 3 hours to finish a dental filling, but now she has only 15 minutes. And the next point is she has to deal with more pressure, especially when she's doing the after-hour clinics at the hospital. And the third one is she has more complicated cases to deal with. Like, for example, when she has to treat an inpatient in a hospital who stays in a hospital with some kinds of illness, there are many things to concern compared with treating a healthy person. Okay, so now the next question is, what is the desirable qualities of dentists in practices? Well, she said that there are 3 qualities that make a good dentist. The first one is be detail-oriented, since dentists have to work on a very small spaces. And the second one is they have to have the medical ethics. They have to treat their patients with honesty. And the third one is they have to have excellent knowledge. Like, they have to understand all the dental procedures both theoretically and practically. Okay, so now Mel gonna explain to you more about the additional skills required for dentists.
Okay, so I'll talk about additional knowledge and skills required of practicing dentist beside dentistry. So the first one is language. Most importantly, English language. So she said that in the clinic, there will be patients who are foreigners, and you must be able to understand English and speak English to communicate with the patients. Also, if you want to gain new knowledge or acquire new knowledge, you have to read an academic literatures. Most of them are written in English, so reading skill is also very important. Next is management skills. So other than practicing dentistry, if you want to open your own clinic or run a clinic, you have to have management skills. Next is time management. So she said that as a dentist, it has a lot of the working time can be freely adjusted, and it's not that fixed. So if you have good time management, it could lead to a good work-life balance. And lastly, it's communication skills. So dentists have to communicate with the patients. So the dentists have to ask the symptoms and also explain the treatment and procedure to the patients and make them understand. So communication skills is also important. And next, Pasin will speak about next topic.
Okay, thank you, Ekanit. In this topic, let's talk about learning experience in the faculty of dentistry. In this topic, I asked her about university life or learning experience on faculty of dentistry, Chulalongkorn University. I can cautiously divide the level of study into 2 parts. The first is about preclinical year. These 2 years are about medical sciences as histology, anatomy, and physiology. That some people think that it's not necessary for dental profession, but actually it is very important because you can encounter with the patient who come with a complicated disease anytime. And second is about the clinical year. These 2 years are the most important year in our life because would be a changing point of our life forever. We learn about real dental work. She suggests us not to careless, study hard and practice every single skill because this would be our eternal life skill. Okay, let's move on to the next topic. This topic is quite interesting for me. It's about life balance. Everyone knows a balanced life is one of the most important factors for choosing to be a dentist. Dentists have much more comfortable work when compared to a doctor. We have much more free time and we don't need to be on duty. But it depends on what you want. If you want to be wealthy, you can, the more you work, the more income you will earn. But if you want to have a healthy life, you can work less and pay more attention to your health. Okay, we finally reached the last part of our presentation. Today we have learned a lot, such as the opinion of dental profession, experience as dentist, and work-life balance. We are grateful to have her in our presentation. That includes all of our presentation. Thank you for attention.